Today we will go a little more advanced away from this kidney, aka acute kidney injury, and we go to this sepsis 3 and the cytokine storm syndrome and the treatment options. Treatment options today I will be a little tricky. Tricky means I will not give you the right treatment option. I will tell you the right practice today, the current practice today, which is CRRT, high volume CVVH. And I will put a question mark at the end of this presentation. Do you think this is the right therapy for cytokine storm? And that maybe you can also use the same strategy for training, like travel with them, walk with them, the way they think, and make them to ask a question themselves that, are you sure this treatment is sufficient for treating cytokine storm? So that's the way approach today I will be doing. You can feel it that. And then we will tomorrow give the result or the answer for it. Before I go with today's topic, yesterday's 2 slides, I want to show it again. That yesterday we talked about the indication for blood purification, which we really understood it is renal indication. Renal indication is the one normally everyone look into, which is all this one. Then we understood there are other many non-renal indications are there. We also yesterday noticed that sepsis is one of the major reason for AKI and multi-organ disorder. And we also yesterday understood sepsis can be triggered by many of the situations like that we spoke. We also yesterday little understood about how the sepsis is happening. If you really able to hear me, otherwise I will repeat it. Today, what I will speak about is, we will not talk about any more renal indication. We will not talk about all that because we covered it yesterday. Definitely, I will share you the video of YouTube, which you can really refer since my presentation was not good. Today, we're going to talk remaining indication for blood purification. And I not accidentally did this classification. I did with a purpose, which you will know soon why I did this kind of classification. Yesterday, we talked about sepsis is a deadly medical condition characterized by whole body inflammation. We talk about the statistics, which is very high, like 1 in every 5 deaths worldwide is because of sepsis. So that's really quite alarming, right? And we yesterday saw this video about how the sepsis is triggered in our body. It's like when there's a bacteria, we have a wound or a cut and some bacteria or pathogen is entered to our system. There will be a signaling from our immune system, which will trigger and bring all these fighters, macrophages here. And the fighters will come and open up, break the endothelial wall and go there and eat up all this. And this is really in normal pathways looks quite easy. Normal way it is a right way to do. It's a different system. But unfortunately, what's going to happen is when this WBCs, the cells are breaking the endothelial wall and go and find this pathogen in all body waves, there will be a leakness of blood vessels. And because of this leakness of blood vessel, we will get other organs damaged. Like we talk about 20 to 25% of the cardiac output is go to the kidney. So when there's a leakness in the pumping, because of the vessels got leakage, so the kidney will not get enough perfume blood, so the kidney get damaged. Same way, you know, the lungs is the one controlling, transporting the oxygen to all the cells. So when the lungs is not able to get enough blood for oxygenation, lungs get failed. So all the body, you can imagine how it's going to be dangerous. So we understood yesterday about the cytokine storm thing. Then the most importantly we speak yesterday is that when this multi-organ failure, more than 2, it is considered multi-organ failure. So normally, sorry for the kidney here, supposed to be lungs. So first will be normally lungs, and then lungs plus kidney, then kidney plus heart and lungs, then lungs plus kidney, heart, lungs. So this is like, as I said, first always sepsis will be attacking the lungs. then it will be kidney. So the more the organs are failed, more difficulty to treat the patient or get back the patient back to the life. That's the summary of what we yesterday spoke about. Today, we try to know who is at the risk of in sepsis. Why this is again most important to you is most of the time, sepsis patients everywhere in ICU, cardiac ICU, surgical ICU, MICU, any ICU you talk about. So most of the ICU having this issue of sepsis patient. So that for HA330 and HA380 like product, you not only have to go with a nephrologist or cardiologist or ICU doctors, there are so many other departments involved. By explaining to you all this therapy, oh, now only you can see my screen. I got a message. I hope everyone can see my screen. Okay, so that's why I really explained to you about more detail about sepsis, especially because of cytokine storm and cytokine removal is the major target of our product. You all know better than me. So let me convince the persons who really want to know, especially our customer, that how our product is useful here by this one there. Who is at risk means actually anyone affected by an infection with severe injury can be in a high risk of getting sepsis. Older persons, pregnant, children, small babies, hospitalized patients, especially ICU, yes, and other immune disease, all this. Okay, now what causes sepsis? Normally it is a bacterial infection. A bacterial infection is the most cause for the sepsis, but fungus and other parasitic infection can also cause sepsis. A viral infection like COVID, we recently, last 2 years, we saw COVID really also caused sepsis. And that's why HA330 was really able to help there. And that's the story we want to spread to all the world, all the peoples in the world, to tell that sepsis was, and COVID was treated by HA330 because of being able to control the cytokine storm triggered by COVID. Because this COVID virus was something new to our body and they got afraid. They got a storming immune system. So the most common type of infection that can lead to sepsis are mainly the infection of abdomen, including appendix or abdominal cavity, gallbladder or liver. And that's the place, especially some of the countries, because of their food habit, or I don't know, they really get a lot of surgeries and a lot of problem in the industrial system. And sometimes if they don't treat it properly or treat in time, it will become a sepsis. Central nervous system infection, including brain or spinal cord, and infection of lungs, such as pneumonia, of course, COVID-19 we saw recently. Skin infection also can cause catheters, all this can cause sepsis. In ICU, mainly because of this catheter, many catheters, many IV fluid, sometimes it's happened. Now, who is at the risk? One more one more easy way to understand by the disease way is majorly this 6 condition. Major surgery, ARDS, acute pancreatitis, leptospirosis, dengue fever, especially in the tropical country of Asia. I will ask you how it is, and severe burn. Now, I will explain to you 1 or 2 slides for each of this medical condition, not to make you all medical expert, but at least you will know that where to promote HA330. At least you will have an idea which are the patients tomorrow and the 24 hours can be in sepsis stroke. So this is really, especially gastroenterologists, they are all our target, They are our targeted customers, we can say that, because they all get patients who will have requirement of a cytokine removal. And that's why I say it's like HA330 is one of the products which we can have a lot of opportunity for helping people. Or we can say a lot of place where we can really promote it and really doctors will allow it. We will see that coming today and tomorrow more detailedly. Let me tell you why sepsis is a risk in the major surgery. It's just because of when the major surgery they do, short after the operation sometimes, the patient gets this sepsis and they get more hospitalization, more in ICU stay, sometimes it can be worse. We have seen a lot of stories like that. Surgery was normal. Patient complete the surgery successfully, but another 48 hours or another coming hours or days, the patient get a problem and die. We all wrongly sometimes think it's because the surgeon did something mistake with the surgery. No, it's commonly sepsis. There is so many reasons. The most common place for the problem of surgical ICU. That's why you can see so many surgical ICU and they have so many such patients. It can be life-threatening multi-organ failure. So what happened is after surgery, sepsis, and it will fail the kidney or other organs, then it's out of control. Same common pathway for COVID and other situations. Okay, please let it be clear. And mainly it's because of the direct effect of these anesthetic drugs and hormonal change due to the stress of the surgery to the body, and the hemorrhage and blood transfusions, and also ischemia and perfusion, and the surgical trauma. Some of the surgery really create a lot of trauma because of the cutting and everything. So these are, plus the underlying illness and comorbidity factors like age, gender, previous surgery or previous situations or patient's conditions. This all together put most of the patient in surgical procedure, which can be any surgery, into a situation they can get a sepsis. Now, this is one of, if you ask me which surgery caused most of the sepsis, even though we know that the bone surgery or arthroplasty surgery is the longest surgery, but cardiopulmonary bypass surgery, heart surgery, which is the one really caused a lot of trigger to patient get sepsis and MOD. And that's why post-cardiac surgery, many times patient required a CRRT. You can see that. You can ask the nephrologist many times, more than surgical ICU. This is because of two reasons. Number one is, if you see here, this cardiotomy, there is a suction we'll be doing because they have to do the open heart surgery. So there is a heart lung machine which take over the job of the heart and the lungs. So you can see the pumps, this size of the pump, tubing and everything. I will be having tomorrow some slide to show you the picture of it. So because of that mechanical bioincompatibility, the body's immune system will get triggered. So also the shields we use, mechanical damage of blood component. Again, its contact with the air and artificial suffers a lot when this heart lung machine is performing a lot of work. And anesthetic trauma, same like what we saw there, injuries and blood transfusion, other factors. Mainly, you may see if the patient really had a one attack and second attack, and the doctor will say another one more attack, it's very risky. So you have option that do a surgery, high risk surgery. And the patient go for the high risk surgery will be good. Then after that, patient will be in ICU. Then patient needed CRRT, patient get, this is all because of sepsis. And there is, we will talk about the solution tomorrow, HA380, how we're going to handle this situation. It's become a common practice now to save these patients from post-surgical issues. We do have some scientific literature to explain tomorrow. But today you just come to, just remember that any surgery and especially CBP can trigger sepsis, right? That's enough for today. And now let's talk about the ARDS, acute respiratory distress syndrome. This is mainly actually, that's a respiratory failure characterized by the inflammation of the lungs or any situation. Okay, and now the patient will really definitely have a shortness of breath and all these issues. This is normally occur when this fluid build up in this tiny elastic air. So this is called alveolus. You can see here. So there you get some kind of fluid buildup, which will block this transport of this gas, which is carbon dioxide or oxygen, and which really create this kind of issues. The main problem is something happened to the lungs is easy to spread to all body. Right. So this is what this syndrome. So how it's going to be a problem for sepsis is because it's get easily to spread to the bloodstream, especially we saw in COVID-19 disease. Okay, and severe pneumonia is normally one of the major reasons for ARDS and COVID, which we saw. This is really challenging where the sepsis can occur. I will just give you a little idea about, I wanted to remember this disease name. That's all my purpose here. Okay. And leptospirosis. This is, I don't know how much bad in your countries, but in Asia, we do have still problems in the villages. Children or people's never use normal shoes or cover for their skin when they are going to mud or any kind of the place which is not that clean. So there's this bacteria can be there. So this bacteria can really cut through our skin or mucous membrane and go to our body system. So of course, you know what then our immune system will react. When it's too many of them, of course, it's going to be sepsis. So it's a simple pathway, the common pathway everywhere you can see. You can write the chat box if the leptospirosis is common in your country. Then those doctors also you can really talk to them about sepsis, HA330 and its use. And right now we're getting so much rainy season here in Asian countries, and dengue fever is one of the biggest challenge here. And this is again a mosquito spreaded disease. It can start from the mild flu and it became again a lot of problem and coagulation issues, and it will be really a serious problem. And we used in many countries here HA330 for the treating patient with the dengue fever. Again, it's a misunderstood, just like COVID. What happened is dengue fever is caused cytokine storm and sepsis-like situation, and we really take care of it by HA330 filter. Then the last one, not least, but I have to speak to you about the severe burn. Severe burn, how it's connected with sepsis is when the wound is big and the patient gets some infection from the bacteria or surroundings by this wound. Of course, the fluid loss, blood volume decreasing, hypovolemia, again create an issue of tissue perfusion and get MOD there. But I'm not interested in other reason, other problem with the severe burn here. All my interest is when the patient have so much open burn, open wounds, infection can happen, or pathogen, bacteria, an organism can go into the body and bloodstream. So that's the way there the common pathway of sepsis will happen. So these all are the sepsis, the reason for sepsis. Why we're focusing a lot on sepsis is because our HA330 and 380 is there to treat the patient in sepsis. Treat means a rescue therapy, which we will see today and tomorrow. Today, little we will discuss. I think tomorrow we will see how it's become a rescue therapy. We buy time. We buy time for the patient's body to fight the organism or use the antibiotics to kill them. That's what we do with hemoperfusion, right? So now sepsis symptoms, if you look into that, they have TIME, time, temperature, infection, mental declines, and extreme illness. So that's the way it's going to the where patient not more responding. The early symptoms normally like warm, fleshy skin, decreased BP, increased heart rate, respiratory rate will increase, restless and anxiety. And when the patient became a we can call this hyperdynamic and hypodynamic, okay, spelling mistake. So hypodynamic is like a cold skin, totally opposite to the first stage. Then you got vasoconstriction, the vessel became smaller. Then severe hypertension suddenly, then it became severe hypotension, cardiac output will decrease, then increase the heart rate, then the respiratory rate will be increased, then it's decreased, then acute kidney injury, hypothermia, decreased carbon dioxide, coma. Just go like that. Right now, the treatment options, if we look into that, normally it should be considered as a medical emergency. Immediately, the patient should be treated when there's a sepsis. It's recommended that patient with sepsis or sepsis shock should be admitted to ICU within 6 hours. And if you delay to admit this patient to ICU, it can really create a lot of issue to the life of the patient. Early diagnosis. Actually, it's like 48 hours for us to get a culture report, but you can start about antimicrobial mixed therapy like gram-negative and gram-positive together. Still, the result is on your hand. Okay, now the intervention, if you look into that, first they try to do the perfusion, like that IV fluid, increase the IV fluid to get the blood flow to the system, all the organs, and vasopressors, and keep monitoring the pressure, the mean artery pressure, and they also use dopamine to help increase the heart const. Now, we will talk about it. In this condition, if you start sometimes SLED or CRRT, the patient blood pressure again drop a lot. And that's why sometimes you cannot help the patient with the CRRT when the patient is in severe septic shock, because already blood pressure is too low and you connect your machine and take some of the blood out, it's going to be worse. That is another story there. Then oxygenate, patient will be oxygenated, mostly patient will be intubated and go for ventilator. Then think about do the culture. Immediately they have to do the culture and start giving antibiotics. Then there is a previous, not now, previously, now we do hemoperfusion. They used to do decrease this inflammatory reaction, that cytokine storm, by steroids and other kind of medicines, but it's never helped that much, to be frank. And nutrition, that's one of the major important situation. Reason to do, mainly they will handle it. Controlling blood sugar also one of the biggest advantage for support the immune system. I just speak it very fast because it's really, I know we are, I'm not doing a training for nurses and doctors for the customer. It's our internal training. So the purpose of I'm saying to all of you this is that just have an idea about how this is look like. Sepsis 3 and cytokine storm is something which we have to also understand a little bit, especially when you read the literature and when you talk to these people. This definition of the sepsis or sepsis shock were last reversed in 2001. Is keep on reversing, and now people are also again suggesting so many other terminologies there, which you can see that. So then the sepsis 3 is recognized as one of the new terminologies, just like we made CRF to ARF to AKI in chronic kidney disease. The definition is that sepsis defines organ dysfunction as increased the total circulational organ failure assessment so far, scored by 2 points or more from the baseline. So just understand sepsis 1 and 2 is that when there's an infection is suspected and the patient became SIRS. They say sepsis 3 when the patient is suspected infection with the indication and the SOFA score is shown by 2 points or more in the baseline. SOFA score, I will not detail you much, but just have a look into that. This is a score which is they try to do an assessment to see that how severe is the sepsis, how many organs are affected, and that's what it is simply. And this is a website where you can go and learn more about it. In fact, let us move on from there, not hanging too much on there. Let's come to our important technical point, cytokine storm. Because all at the end, all the story which I spoke yesterday and today will come to one point, cytokine storm. Okay, this is really, the cytokine is really became a hyper-inflammatory status, which is like you can see in this animation that is storming out and worsen the disease condition and damaging other organs. That is what it's exactly. Cytokine storm syndrome is a problem of immune system dysregulation that makes life-threatening symptoms, which is MOD basically. Body produces too many inflammatory cytokine that and not all those cytokine that modulate inflammation, which I will be explaining in coming slides. The inflammatory cytokine starts storming out of control without elder feedback from the anti-inflammatory cytokine. So now you have two peoples here, inflammatory and anti-inflammatory. I'll make it simple and explain to you what are they. And it is important for us to know also. Before that, let you understand that when the cytokine storm is really an act, a very low blood pressure and patient have an increased chance of blood clotting. And also you can see there are so many other situations like cell death, immune paralysis, renal failure, that's what all this will happen, multi-organ failure. Now, what is cytokine? Cytokine, this word is come from the Greek word cyto means for cell and kinosis means movement. So moving cells are moving around everywhere. Okay, that's what the cytokine meaning. Actually, it is a family of protein that's important compound in our immune system, which is really help us to regulate or fight the organism. Even we give antibiotics and medicine, they are really walking through or working through this immune system. They're provoking, even you know that with the vaccine, how we take it. The vaccine is actually even COVID vaccine by taken. The COVID vaccine actually provoke our immune system. And there is they understood how to, the immune system is back up and be alert for the real virus come, how to deal with them. To be frank, is a good thing. And typically the cytokines are molecular weight, if you see 5 to 60,000 Dalton. Okay. So this is, keep in mind, your dialyzer or your hemofilter is up to 30,000 Dalton. CRRT I'm talking about. Now, cytokine, I can speak in this terminology, especially we talk about sepsis and cytokine storm. We can divide them to the good cytokine, the bad cytokines, and the deadly and ugly. As I said, the cytokines help the immune system to respond to the disease. And the drugs, sometimes we use the drugs and we give an amazing treatment effect with the help of the drugs and cytokine together. That's the way immune response is. Because a cytokine may be good when it stimulates the immune system to fight the foreign pathogen and attack the tumor, of course. But they may be bad when they are express case inflammatory disease, what we see the sepsis. And some antibody, just for extra information, for some antibody therapies can use ugly cytokine release, which can be deadly. That's why some medications, which is really sometimes create or trigger deadly cytokines. That's for the information. So let's understand what is this pro-inflammatory and anti-inflammatory cytokine, as I said. Some cytokine act to make the disease worse, which is pro-inflammatory, where the other, which is promote the healing, which is anti-inflammatory. This is quite confusing, but at the same time, it's quite interesting. So we need the healers. We don't want these talking peoples. Like you can see that, okay, we are losing the war, activate cytokine storm. This is what happened in the body. When the body feel like, okay, the bacteria is winning over. So really, what we do is this pro-inflammatory cytokine like TNF-alpha, interleukin-1, interleukin-6, all these are really alarming the system. It's go alarming everywhere and weakening the blood vessel. And because this system is activated, as you can see that the anti-inflammatory cytokine will not be able to do its job properly, or there is, before that, we get other organs damaged. Okay, forget about the last one, 5 to 30,000, I will correct it. Now, the treatment options, I'm going quite faster because we lost yesterday some of the time. Treat the cytokine storm. I mean, to be frank, that's the best way to do here. The mortality remain higher, okay, according to the number of organs are involved. Survival is dependent upon the treatment of the post-operative supportive care. Supportive care, which I mean is support the patient to control this after effect or this problem of the sepsis storm, cytokine storm. It's often a common pathway on systemic inflammation. As you can see that it's triggered the endothelial injury and resulting in the multi-organ failure. So that's a simple way. It's not like such a big rocket science or big medical terminology, which we need to take a MD in that to understand it. It's very simple pathway always, no matter which disease it's going to be, like I explained. The first step about treating sepsis 3 can be antibiotics. Treat the patient's organism, which is attacked, and try to kill it. Then the patient blood pressure is dropping. You try to give an intravenous fluid to give the perfusion properly. If it's not working, give vasopressors or dopamine-like medications. And most importantly, tell the body's immune system to calm down. Don't overreact. Calm down. Calm down. You're not going to lose the war. We are here. You're in ICU. You're in this hospital. You have this many medication and doctors are taking care. You calm down. Don't kill the patient. And for that, we have to remove all the cytokines from the body. So turn down the part of this immune system or complete the immune system for that moment as it is overreacting. And that's what the best thing to do it. And the timing is very, very important in that all these 4 functions when we're doing it. And mainly if you talk about the treatment method of the cytokine now, commonly they go for the renal replacement therapy treatment nowadays when the patient have this cytokine storm and sepsis. And in the recent years, application to eliminate this inflammatory cytokines are frequently used as a new treatment method of sepsis. Yeah, it's true. The clearance of inflammatory mediators from the circulatory system reduce their plasmatic peak and the harmful effect, which we are discussing for last 2 days. We started 7:30, we have enough time. So this is what I just want to let you know that. Your low flux dialysis or SLED, if you do, is up to 5,000 Dalton. It will not remove the cytokine. You do CRRT with any of the filter. It will not completely help to heal the patient from cytokine removal because it's 30,000 Dalton. You know, HA330 and HA380 is molecular weight cutoff is 60,000 Dalton. That's the answer. That's a simple answer, but we're going to deeply dig into that more detail to convince the people, because you all understand it, because you are working with us, you all know about HA330 and everything. But the people who don't know that, we need to give them more proof, more lecture, more understand details to make them understand. So now, currently, what is happening, especially in Europe, in your countries also, SLED or CRRT, IHD, 2 hours or 3 hours of slower dialysis, or SLED, which is 6 to 12 hours, slower dialysis, again is dialysis, or continuous renal replacement therapy using CRRT machine. These are the 3 treatments traditionally used, other than hemoperfusion, for treating the patient with AKI and cytokine storm. So that is the first part of our presentation.